Hello, everybody. Welcome. We are so excited. We're on Instagram talking a little bit about gut health, and here we are bringing you the details of gut health and miscarriage. So, a real case review. Kaylee and Carrie are going to be leading this. So, we are all here as part of the dream team, and we are very excited to bring this to you. So, if you want to learn more about us, I'm not going to waste time and do intros and bios. Please go to our website, yourfertilityyourfuture.com, and check us out. Check us out, who we are, our credentials, who we support, and how we help them. So, feel free to add in questions in the chat as we go here. Just put those in here. I'll be monitoring that, and also at the end we'll open some time up for some live Q&A. But feel free. I mean, this is very casual. We love hearing from you guys, so just put those into the chat as we go, and we're gonna dive in. So I'll let the ladies take it from here, and I will be here for whatever we need.
So I'm going to start off since I was the first to meet with our client. She had come to us because she was currently undergoing her third ectopic pregnancy. So we were trying to see, like, let's dive in deeper. Let's see why this keeps reoccurring. We did just a strategy session, so just one session together. And I just wanted to walk you through kind of like the information that I was getting as I was getting it, just to kind of show you how we kind of put the pieces together in our minds and start to piece together some of these, random quote unquote symptoms that she was having. She has a history of tinea versicolor, which, if you don't know, it's just a skin like discoloration that's usually caused by fungus, and kidney stones. She was suspecting PCOS. She didn't officially get diagnosed, just based on she explored that and discovered that with a nutritionist. So she didn't get, the official diagnosis from her doctor or her fertility clinic. But what they found was elevated AMH, elevated androgen, so elevated testosterone, slightly elevated insulin, like very, very slightly. I'm talking like slight of like our optimal functional ranges. Um, Hold on one second. Can you guys see the screen?
Yes.
I can see it, but the comments. Okay, very cool. Just making sure. All right. And then hirsutism, which, if you don't know, is just like unwanted hairs in certain places. It's very common when we see with PCOS. Obviously, she had recurrent ectopic pregnancies. She had these weird cyclical UTI symptoms. They would happen at certain points in her cycle. But when she tested, it wasn't actually a UTI. So that was, pretty curious for us. Her intuition, because that is a big piece of what we always ask all of our clients, is like, what do you think is going on here? Like, what do you think is behind these ectopic pregnancies? And she just thought, like, I just don't think it's like structural. Like, I don't think it's like the structure of my tubes, for example. Like, if she were to have maybe like a oddly shaped tube or damaged tube or something like that, she just really didn't think that that's what the cause was and that it was just something deeper. So her goal was to just, do a thorough root cause workup before she continued to either try naturally or most likely do IVF, just to kind of give herself the peace of mind of bypassing the whole tube in general. She was thinking about pursuing IVF. So that's just a little bit about
These
what are the supplements that she was supposed to be taking from the nutritionist. Not a plan. Um, can be extremely harmful, actually. And there's a lot of repeat things on here. There's a lot of like, we call them glandulars. So like, um, you know, like liver, taking like animal liver, desiccated liver. supplements, or there was like bovine ovary and all sorts of things. There was like four different types of those, which I just think is a little heavy-handed. Maybe pick one. Multiple types of B vitamins. We didn't know what her B vitamin status was. If she had MTHFR, maybe we were just assuming that. I'm not sure, but I don't really know why we were doing that. Too much of a good thing it is a thing, so we didn't need that one. And yeah, I mean, just taking that alone, I feel like is a full-time job that would exhaust me. So yeah, not a plan. Next slide, Olivia. So the way we kind of think about the body is like we're trying to group these different issues that she was having into different buckets. So these are kind of the buckets that we like to think about when we're, just reviewing someone's case and trying to clarify their story and really piece together what could possibly be going on. So thyroid, did have some labs. It was an incomplete picture, but possibly minor dysfunction. Um, Adrenal, definitely HPA dysregulation, meaning she definitely had some nervous system issues to be working on. Didn't have a clear picture exactly on like what her cortisol picture looked like or how that was affecting her, but just based on her symptoms, she has a very intense job. She is someone who internalizes stress. There's a history of trauma, and she was having frequent 3 a.m. wake ups, which tells us like there's probably some cortisol dysregulation there. Why? Not exactly sure, but just keeping, a thumb on that, a pulse on that. Would love for her to have a Dutch test, but after being treated for an ectopic pregnancy with the methotrexate shot, you do have to wait a little bit before getting a Dutch test. A lot of gut symptoms. She did not complain of them. It's just part of our intake captures this. And so we dove deeper into our session. So, what I was suspecting is GI inflammation, absorption issues, low stomach acid. I was thinking it was probably due to H. pylori, which is an infection that Kaylee will dive into and explain in a little bit. Candida, which is like yeast overgrowth, dysbiosis, like an imbalance of good and bad bacteria. And I mean, I knew there was more than that. I just wasn't sure like what else was out there. But those are just the ones that I could like name for sure that I would uh, say was going on. And why was I thinking this? Well, we had that fungal skin condition. She complained of loose stools, yellow stools, thin stools, stools that float, bloating and fatigue after a meal. And none of that is normal. So, and she wasn't really trying to get to the bottom of that, but I think you'll see that that's going to be a huge part of what we're going to be doing with her. Immune system was definitely overactive. She had in her workup with her clinic anti-cardiolipin antibodies. They weren't high to the point of what they would call like what they would treat for with like blood thinners in her next pregnancy. But it was still elevated above normal, and they didn't do the repeat test. So for those tests, you are supposed to have it done, one test done. If it's abnormal in any way, you have a repeat test done 12 weeks later to ensure that it's still high, and then we can see that there's some dysfunction. So in my mind, I'm thinking, well, she has these gut issues and she has these antibodies. Like, why is she making, like, why is her immune system on the defense? What is triggering it? For nutrition, in her labs, it was, suspecting anemia, um, very low ferritin she had. I was suspecting possibly B12 and magnesium deficiencies because she had complained of restless leg syndrome and folate deficiency since we knew that she just had that methotrexate shot, which depletes folate. Hormones, PCOS was obviously on the table. She did have a lot of estrogen dominance type symptoms. Now, I wasn't sure if it was high estrogen and low progesterone, or if it was normal estrogen and low progesterone. I mean, there's a combination of things that it could be between high and low estrogen. It's not estrogen dominance doesn't always mean high estrogen, so didn't want to jump down the path of like using DIM with her, for example, because I actually don't know what her estrogen picture looks like. And we should give her body a little bit of time to rebound after that last ectopic pregnancy. But so keeping it on our radar, but also a lot of those symptoms overlap with endometriosis, of which we haven't ruled out. So we want to keep thinking about that there. The detox, oxidative stress from the methotrexate shot, just because it depletes nutrients that your body needs and wants. And then structural, like I mentioned. So endo, we haven't ruled it out. It is extremely closely linked with ectopic pregnancies. Pelvic inflammation, just suspecting that there's some pelvic inflammation. Now, does that, I'm not saying she has like, HPV, more so saying like, maybe there's gut inflammation that is also causing some pelvic inflammation because the gut and the reproductive organs are neighbors. So what happens in one doesn't stay in one. And then I suspected some vaginal dysbiosis, just, based on those UTI like cyclical flares that she was having. To me, it sounded like they were happening in times of her cycle that where your estrogen is decreasing. And so I was thinking that she probably wasn't getting the benefit of the good bacteria that estrogen helps to produce in the vaginal tract and the urinary tract. And yeah, so that was my theory there. So next slide, Olivia. So these are all the things that she was told was normal. The skin issues, she was been suffering since 2020. It's still ongoing. She's just told that it's normal. It's 5 years later. Pretty big red flag. The cyclical UTI like flares, like I said, flag for vaginal microbiome abnormalities, restless leg, and low ferritin, nutrient depletion. She's depleted in some nutrients. Progesterone issue. The clinic actually in this last ectopic pregnancy that she had, the clinic did do some hormone labs, and her progesterone actually was rising before ovulation, which can slow the hair-like structures in the tubes. In fact, um, IVF clinics, not for the slowing of the cilia and the tubes, but IVF clinics, if you're going to do a round of IVF, they usually do test your progesterone before transfer because it can affect endometrial receptivity. So, something that I just pointed out to her is something she might want to keep an eye on when she does do IVF and make sure that, they're flagging that and tracking that appropriately. And then Clomid use, I mentioned increased risk of ectopic pregnancy and that thick lining. Like what? That's not normal. We don't want to see that. Is that affecting endometrial receptivity? She does have a history of a grandmother um, having like endometrial cancer. So ruling out any issues there is a huge priority for us. Next slide. So our working theory is there's gut inflammation that was maybe feeding overall inflammation, which was affecting the, function, the way that fallopian tubes were functioning. Daily progesterone creams suppress her ovulation and maybe altered some gut motility. Candida, high fungal load with that skin condition, the bloatings, cravings. Obviously, there was some gut immune balance. Clomid and using DIM was suppressing estrogen, and I didn't write it down there, but also when she took birth control, that's going to affect uh, those hair-like structures in the tubes as well. That premature progesterone rise is also going to play a role with those hair-like structures in the tube, the cilia. Inflammation, hormone imbalances causing some thick lining, chronic stress, maybe poor vagal tone. That's also going to play a role in her gut microbiome and motility. Vaginal microbiome issues is going to lead to an increased risk of ectopic. It's in the literature that, certain bad, quote unquote, microbes in the vaginal tract are associated with ectopic pregnancies. And PCOS needing more support for proper follicular development and making sure those follicles don't arrest and she has nice healthy eggs. So her body was literally screaming for help, and she was told all of this was normal, and it was not normal. So we said, let's prioritize GI map. Next slide, Olivia. Let's prioritize GI map and a vaginal microbiome test and see what's going on there. And spoiler alert, we found a lot of things. So I'm going to pass it over to Kaylee because she's going to share with you those results.
Amazing. And you're going to see too that Carrie did some very astute detective work here where we were able to confirm a lot and even uncover more here. So let's go to the next slide here and look at her GI map results. Okay, so we had not one, but two pathogens. Now, pathogens are very very kind of intense imbalances. They are literally GI infections. If you go to a typical gastroenterologist's office, they are only going to work up your stool for pathogens. So GI map is much more sensitive to that, which we'll talk about as we get into these future slides, but not one, but two pathogens. So that alone, when we're thinking about inflammation in the gut affecting the uterine environment, is a huge, huge, huge discovery. And you can have these pathogens without aggressive symptoms like debilitating diarrhea, severe stomach pain, and she does. We have H. pylori. We have severe yeast overgrowth, not just a little bit of yeast overgrowth, a severe yeast overgrowth. We have a parasite, 4 bacterial overgrowths, leaky gut, which is otherwise known as intestinal permeability, poor digestive enzyme output, and fat malabsorption. And if we remember back to the slide with all of those supplements, a bunch of those supplements contained fat-soluble nutrients, things like antioxidants, vitamin A, vitamin D, vitamin K, vitamin E. She could take all those till she's blue in the face. She's not going to be absorbing them because she has poor fat malabsorption. So we have to look up in the gut before we start thinking about supplements here. And so typical results for a GI map, we look at these a lot. We might see 3, 4, maybe 5 imbalances that all individually can be a make or break it for fertility when someone is struggling to conceive or having issues upon conceiving. This is, if we want to count those pathogens and bacteria separately, we're just not even going to do that. It's still 8 plus here. So we have a lot of gut dysfunction going on in her case, and Carrie connected a lot of those dots. Without even seeing this, which is so amazing and just is a testament to how thoroughly we work up people that come in for a visit with us. Okay, so let's talk about each of these individually. Let's go to the next slide. Okay, pathogens. So she had 2 pathogens. Shiga-like toxin E. coli, it's a particular type of E. coli that can produce a toxin, the Shiga-like toxin. So a lot of gobbledygook here. All that means is that a particular type of E. coli has infected her gut and is very likely producing toxins here. She also has salmonella. And so this particular client, she did report a history of food poisoning all the way back in 2016. She didn't think much of it. She felt horrible. She got over it in a couple days. She moved on with her life, right? That's kind of what we always think about when we get traveler's diarrhea or food poisoning or just feel a little upset after maybe eating out at a restaurant or something like that. Well, despite the fact that she felt fine and moved on, these particular pathogens can still be lurking and causing issues in the gut that echoes across other systems here. So these 2 in particular, they can increase endotoxins, something called LPS, which stands for lipopolysaccharides. So this is really important because these LPS molecules, they activate inflammatory pathways. So when we are thinking about global inflammation that is affecting those fallopian tubes, these particular toxins can reduce that tubal motility. So that cilia that Carrie was talking about with a lot of these other things that she had worked up already, these particular pathogens, the toxins they produce, can also slow that tube motility, creating a more optimal environment for an ectopic pregnancy to happen with. Chronic low-grade immune activation, so that preference towards immune overactivation that Carrie identified. This makes a lot of sense when we're thinking about 2 pathogens that her body is constantly aware of and kind of trying to control their levels of and trying to blunt her system against some of that inflammation that can be produced here. And so that in and of itself, even if that particular egg got to the endometrium and tried to implant, could affect that implantation as well. So when we're thinking thinking about, oh, if she just went right on to IVF and we didn't know this, well, what happens when that IVF round maybe is not successful? And this could be a reason that could be the case, that it is getting in the way of that proper implantation, no matter how she's trying to get pregnant here. Okay, we'll go to, oh, and then important thing about this slide too. Sorry, Olivia. Shigella toxin E. coli. So if she were to take antibiotics, say she gets a UTI and they maybe don't do a culture or do a culture and they're like, well, it's negative, but take antibiotics anyway. That can happen. The antibiotics that she would take could actually make the Shigella toxin E. coli more resistant to treatment. And so that would be obviously an issue when we're thinking about trying to get her on the other side of these GI imbalances here. What can happen if she were to take antibiotics with this? It can affect the kidneys. She has a history of kidney stones. And so it's just things that we're always thinking about here, and that we looking under the hood of a GI map results can really echo across other systems in her body here. Okay, next slide. H. pylori. Okay, so possible anemia we have in her history here. H. pylori will actually lower the body's ability to absorb minerals. So that includes iron. So related back to those low ferritin levels, it includes B12 that Carrie suspected was low. All B vitamins can be affected as well. And then magnesium and zinc. So also super important when we're thinking about the health of her adrenals, the health of her thyroid here. H. pylori can also, you're going to hear this word a lot for her, inflammation. It can promote inflammation. It can skew that immune system towards a Th1, Th17 dominance. That's very common in endometriosis that we're kind of thinking about could also be going on with her with that very thick lining. It can reduce progesterone sensitivity as well as impair endometrial receptivity. So again, had she just gone right onto IVF, maybe it would have worked. Probably not, given all we know about her gut here. She also, it's not pictured on the slide, but there was also antibiotic resistant genes associated with this H. pylori overgrowth infection in her system here. So again, had she done antibiotics for probably another reason, it could make this H. pylori a little bit harder to treat. Had she done something like a betaine hydrochloric acid supplement that someone might just put someone on when they're thinking like, oh, we just need to improve someone's gut health, that could also make this H. pylori harder to treat and turn it into something called the cocoid form. So another thing that is, we want to test, not guess, especially when we're choosing supplements for someone a lot of the times, because we can accidentally make things worse. And so again, this could be another key root cause of that ectopic risk and implantation failure for her. And reminder, she did not have reflux symptoms. She did not have GERD. H. pylori commonly associated with a history of reflux, with a lot of burping or belching after meals, with that kind of upper pressure, right, kind of under that sternum here after meals. You can have H. pylori, you can have an overgrowth of H. pylori without having those symptoms. And so you can be asymptomatic, but it can still be causing inflammation. It can still be causing a lowered level of stomach acid that's affecting your body's ability to absorb nutrients. So super important for her. All right, next slide. Severe yeast overgrowth. So why we say severe in this case is that this is aggressively elevated above the reference range. So she had a particular type of yeast called Candida. You've probably heard about it. People talk about it a lot on Instagram. If you Google this, you're going to see like the most craziest restrictive diet for Candida. Spoiler, she's not going to be put on a Candida diet for this. But this is a severe overgrowth. GI map is, again, so much more sensitive than a stool test you might get if you walked into your gastroenterologist's office. So if you just go to a gastro, you're going to get maybe a breath test for H. pylori. Spoiler alert, it only identifies it if it's super aggressively high. It may not have even picked up her levels here, even though they're above the GI map reference range. And it's not going to test for things like Candida. It's not going to test for some of these other bacterial imbalances we see in future slides here. And GI map, Candida is the great evader. And so it will hide itself in something called biofilms. So the fact that it was picked up on the GI map and at such quantities tells us that it's actually much higher than even these results are showing us. So this is classified in my mind as a severe yeast overgrowth. And we don't see, again, a lot of GI symptoms in this particular woman here, but she does have a lot of signs and symptoms of yeast outside of the gut. So the skin infections here, the vaginal dysbiosis that we suspect, even activation of the adrenals and that immune system here can be correlated with yeast overgrowth. And Candida species produce, again, a lot of toxins that create a lot of inflammation. So it's driving that immune activation. Something happens when the body gets pregnant, it actually switches to a different arm of the immune system that actually should calm things, because we don't want the body to reject that embryo that's implanting. And so much of this is actually preventing her body from effectively switching to that receptive part of the immune system that's going to help her sustain a pregnancy. So super, super important findings here. And then when we're thinking about possible endometriosis, why is her lining so thick? Well, Candida thrives in estrogen-rich environments. So that makes sense when we're seeing that thick endometrial lining when we are thinking about endometriosis for this particular client here. And it disrupts the estrogen-progesterone balance. So even though we don't know the exact estrogen-progesterone dynamics right now, because we can't do a Dutch right away, we suspect, just as Carrie suspected as she met with this client, that there are estrogen-progesterone issues here. And then, of course, contributes to estrogen dominant symptoms overall. So a lot of the other symptoms she's experiencing, things like PMS, bloating even, can be related back to a little bit of an estrogen dominance presentation here. And so a lot of different things can correlate with yeast, especially such a severe yeast overgrowth. And credit due where credit's due to the nutritionist that did work with this client before. She did also have a hunch that Candida was present. And she did have some options in that very long page of supplements for a yeast overgrowth here. Might have helped her, might have not, just in the constellation of everything else that was recommended. Even though it might have been a good supplement for her, taking it with all of those other supplements, she would have felt like total crap, and we wouldn't have known that, like, oh yeah, this yeast supplement is going to help. So being super, super strategic with how we go about addressing these and in what order is going to be really crucial for her when basically everything is lit up like a Christmas tree in her GI map here. And then UTI, really, really common when we're thinking about Candida overgrowth. So even though she's tested negative for these cultures for the UTIs, Candida can be playing a role. Fungal overgrowth can be playing a role in that as well. And really her only symptom other than skin issues and UTIs was sugar and sweet cravings. How many people report that? Tons and tons of people report that come into us, and it can, we know that it can signal something deeper going on in the gut that should be worked up here. All right, next slide. Parasite. So again, this is one where everyone goes, oh my God, I have a parasite. It's the only thing they focus on when I tell them it's in their GI map results. She has an Entamoeba coli parasite. This is actually really low in priority order when we're thinking about everything that came back for this particular woman. So despite what you see on Instagram, the prior 3 slides are more important to this woman's story, reducing her risk of ectopic pregnancy going forward, setting her up for a successful IVF should she choose to do that. Parasites do not always require an aggressive parasite cleanse. In this case, and we'll see some additional markers of just how her gut terrain and her whole ecosystem is functioning, but parasites are often a sign that that gut terrain is poor. She doesn't have protective mechanisms to essentially kill a parasite when we're exposed to it in our water, in our food, from a pet, from swimming in a lake. So it's actually more common to see parasites come up. You are 100% encountering parasites in your life, but what should happen is you take in that parasite and it is killed by proper stomach acid once it gets to the stomach. She doesn't have proper stomach acid, likely due to that H. pylori here, as well as some other markers of digestive insufficiency here. So it really just signals that the gut is vulnerable. Well, heck yeah, we know that by looking at this whole test here. And so this isn't something that really is going to need aggressive treatment. This particular type of parasite, non-pathogenic, low levels here, the orange in this particular number here, is a lower level than if it was a red, a higher level of that pathogenic presence here. And so it's actually really low in her treatment priority here. And it will likely naturally go away on its own when we work on strengthening her digestive output, when we work on balancing her immune system in the gut, and when we help to actually grow good bacteria that are going to naturally kind of crowd this out. So just because she has takeaways, just because she has a parasite, do not have to do a parasite cleanse. Carrie made a joke earlier about a full moon parasite cleanse. Does not have to be that either. We really work on the gut terrain, and all of that work in the gut terrain is going to keep her protected from parasites she encounters in the future. So super, super important here that, you know, we're not just doing in functional medicine, we're not just doing a different version of a pill for an ill, where instead of a medication, it's a supplement. We are actually looking at the deeper reasons this particular woman has a parasite in her gut here and addressing that so she can improve her resilience to that going forward. Next slide. Not one, not two, not three, 4 bacterial overgrowths here. So again, when we're looking at the particular species that come up, you know, GI map tests for about 30 different bacterial, opportunistic bacteria. It also tests for your core microbiome, your commensals, your good bacteria, those probiotic species we see in supplements here. So 4 came back. That's quite a lot that are above the reference range here. These first 2, staph and strep, very, very common to see these overgrow when we have low stomach acid. So we have that H. pylori affecting stomach acid production here, creating some inflammation in the gastric cavity in the stomach, which sets up for staph and strep to be able to opportunistically overgrow. So again, we probably won't treat these aggressively by themselves. We're going to fix the stomach acid. We're going to get rid of that H. pylori, and then these species will naturally come back down into a proper balance. Bacterial overgrowths don't always need to be completely eradicated, so we're not just like killing. We can rebalance here. And so depending on the bacteria, they can produce biofilms. Histamine, which is often associated, a higher histamine presentation is often associated with more estrogen, with an endometriosis picture. And they can also trigger that immune hyperreactivity. So that immune system overreactivity that then affects implantation of that embryo. Some of these guys are associated with chronic pelvic inflammation, especially the Enterobacter here. They have been also detected in the vaginal and fallopian tube microbiomes of women with infertility. So super, super important here to get some rebalancing done with these particular bacterial strains, especially the Enterococcus and the Enterobacter, because these guys play an active role in the microbiomes of women with infertility. We see this in the literature. And then Enterobacter, again, here produces those endotoxins, activating the inflammasome, activating inflammation, driver of pelvic pain, and even without pelvic pain, that can sometimes come with endometriosis, can still cause implantation issues. So we're still thinking about the same risk factors here for this woman in a lot of these different markers, really kind of coloring all of the instinct and all of the findings that Carrie found when she brought this woman into practice. Next slide. Leaky gut. So leaky gut, otherwise known as intestinal permeability. That is the technical name for this. You can think of it kind of like a fence. So if your fence has big sections missing of it, your dog can run away. In the body, what is actually escaping is food particles, bacteria, inflammatory chemicals. And so this creates the perfect storm where your immune system goes, all of these things aren't supposed to be in the bloodstream. They're supposed to stay in the gut. So when I see them in the bloodstream, I'm going to mount an antibody response. I am going to protect you from them. And so that's great if it happens only a little bit, but when it happens a lot, in the case of leaky gut, in that intestinal permeability, the immune system is overreactive. It is on high alert, and it is looking for things to kill and control. And that creates a lot more inflammation in the body. And so border control breach, you can think of it just like hormone chaos when we have a lot of that border control breach. And unfortunately, we have to work a little bit harder than we used to maintain a nice, tight, sealed fence that doesn't have little holes in it in our modern day environment. But it is absolutely possible, and not always related to supplements here either. And so again, leaky gut, intestinal permeability, known risk factor in endometriosis. implantation failure and miscarriage. Oh, and then on prior slide, PCOS, we're thinking PCOS for this particular woman. All of those bacterial imbalances. It is also known and documented in the research that bacterial imbalances have been associated with PCOS and actually interrupt proper insulin signaling in the body. So it can make insulin resistant worse. It can make the metabolic pieces of PCOS worse, make that high androgen, that high testosterone a little bit worse as well. So connecting to other things in her case history and what we're kind of thinking about in terms of her hormone presentation downstream from the gut here. Signs and symptoms of leaky gut here. Skin issues. Skin issues can also be associated with leakiness in that gut. Food reactions, fatigue after eating. So things that people are just like, oh yeah, this is normal. I'm just going to brush it off. You know, I'm working on my hormones. I want my hormones to be balanced. What do I got to do for my estrogen? What do I got to do for my progesterone? Well, we got to look back upstream at the gut here in a lot of these cases. Okay, next slide. All right. And then these are some of the markers where we're looking at that terrain of the gut. So we want to see how she is digesting and absorbing her food. And so we have for this woman, we see both fat maldigestion. That first marker, steatocrit, is elevated when there are too many unbroken down particles of fat in the stool. So that fat shouldn't make it to the stool. It should be absorbed way up in the GI system, in the small intestine, and even a little bit in the stomach. And then we also see poor enzyme output. So the second marker here, elastase 1, it's a little bit of a surrogate marker of pancreatic enzyme release. So even if your pancreas doesn't have any problems, it cannot release enough digestive enzymes. And so for this particular woman, you can see it's in the yellow. But for someone her age, we like to see that about 500 to 600. So she definitely is having a suboptimal level of that pancreatic enzyme release happening here. So going back to some of those supplements on her original page here, her prenatal, all of these fat soluble nutrients, I believe there was some omegas on there, are all going to be not absorbed properly and probably make her GI symptoms worse because we're going to see more of that fat malabsorption in the stool here unless we address why it's happening in the first place. So food not being absorbed properly is kind of the downstream effect of this. Well, what do we need food for? We need nutrients for pregnancy, for conception, for sustaining a pregnancy. Very, very nutrient intensive. So again, she could be eating a perfect diet, taking the exact right supplements in the exact right amounts, but her GI map shows that she's not absorbing them properly. And so we can't use what we don't absorb. This can lead to deficiencies in cholesterol. Well, what do we need to make progesterone? We need cholesterol. What do we need to make estrogen? We need cholesterol. We need fat-soluble vitamins for all of these hormone precursors, as well as, of course, carbs and proteins. Vitamin A and D, also really important for immune tolerance and embryo implantation. So her prior provider was probably right. She probably does need more vitamin D. She probably does need more vitamin A. She probably does need more vitamin E. But right now, she's not absorbing them. So we have to address that first. And then she's going to be getting more from food. She may not need an additional supplement for some of these. She may need a little bit more vitamin D in a supplement. You know, it all kind of depends on how the gut is functioning for her here. And then stomach acid here too. Oh, sorry, Olivia. One more thing for this slide. There's no exact testing for stomach acid in a GI map, but when we see poor enzyme output, when we see poor fat maldigestion, we have to have proper stomach acid production to send the signal for the gallbladder to release bile and for the pancreas to release those digestive enzymes. So we also suspect, given that she has H. pylori, she probably isn't producing enough stomach acid and not sending this signal here too. So it's not a matter of, okay, she just give her digestive enzymes in a supplement, give her some bile factors in a supplement. If we address the H. pylori and the stomach acid production, she may not need an actual supplement to begin digesting her fats, producing that proper enzyme output here. So really, really important to kind of connect the dots back up as to why things are happening even within the landscape of this particular test. And again, a couple of symptoms she had related to this. She had some floating stools. Her stools were clay in color, a lighter tan color, and she had some bloating sometimes. And again, she was kind of like, I'm not really here for my GI symptoms, right? I'm here for my ectopic pregnancies. Like, why is this happening to me? I want my hormones to be better. I want to get pregnant. And so these antioxidants are vital for that immune tolerance and embryo implantation.
Hey, Kaylee, not to put you on the spot here, but can
Yeah.
you also explain how H. pylori can be transferred between partners and if you have it on the top of your head, how it can affect sperm health?
Yes, yes, yes. Okay. So important because when we see H. pylori, especially at her levels, it's probable that her partner may also have it in their oral cavity or in their stomach. And so we like to, when we test and treat for H. pylori, to treat everyone in the family at the same time, ideally. And there's a couple different ways to do that, but because partners can pass it back to each other. So whether that's even sharing a silverware, whether that's obviously kissing and things like that, they can pass it back and forth. So super, super important too. If we're going to treat her for H. pylori, we need to be getting her partner on board, and anyone else she might be kissing. Kids too can also be a reservoir for H. pylori here. And so we need to be thinking about that to make sure we're not going to treat her and she's reinfected 5 days later. Also cleaning dental appliances are super important. Switching out a toothbrush when we're treating H. pylori, because they can also be a reservoir that you can add back into that oral microbiome. And then, H. pylori is back in the gastric cavity too as well. And then sperm, H. pylori, very, very tied to sperm health. We see lowered absorption again of all of these antioxidants. Antioxidants are crucial for sperm health, for proper motility, for proper morphology. So if you are not absorbing and assimilating those nutrients because you might have H. pylori, lowering that stomach acid, super, super important to work that up here. What am I missing about sperm, Carrie?
No, I think that's
Something, I'm
part
forgetting
of it.
something.
Yeah.
Okay, okay.
And then there was some literature about how if the man has H. pylori, uh, I mean, it's like it sounds scary, but it's not, because we can just treat the H. pylori, but it would cause, like, I think there's some connection with like some of those anti-sperm antibodies, or it
Yes,
could
that was
be
it.
that her body creates antibodies to his sperm as well.
Yes, that was it. Thank you. I knew I was missing that juicy study here. So really, really important. He could come in and do a full GI map. That would be great. That's what we kind of prefer in these situations. But when we see H. pylori, we make sure to get everyone involved when we're thinking about treatment plans here, so that we can be successful for everyone's risk factors associated with that particular bug here. Great. And then next slide. Almost there, everybody. I know this was an information heavy webinar. And so just at the core of this all is why it's crucial to, I would say, before even testing, get a proper workup. Someone that is going to really comb through your history here and identify all the things. Remember back to that slide, all of Carrie's thoughts about what was happening confirmed in this GI map, right? So we didn't have the test when Carrie did that original workup here. And so these hidden gut imbalances can fuel inflammation, progesterone resistance, poor ovulation, embryo reduction, and increased risk of miscarriage or ectopic pregnancy. And so we love testing for cases where we really suspect the gut is a primary or a very important root cause, because we would not have known all of this had we not tested. And now that we have this information, we can be very precise in our treatment for her. We are not going to waste time guessing here and kind of just throwing stuff at the wall, throwing that spaghetti at the wall, seeing what sticks in terms of, prior approaches here. We are going to be very precise in how we can improve her gut health as fast as possible, so that when she's ready to start conceiving, trying to conceive again, she will be ready here. And so it's really about clarifying that story for her. We don't want her spinning wheels, taking this progesterone, especially taking it incorrectly, when there are things that are preventing proper progesterone production in her case, and that are hindering estrogen detoxification. So the balance of those two are not optimal. And so that all goes back to the gut absorption and then estrogen detox here. So really, really important. And, we see in the literature women with IBS, which is a diagnosis by exclusion, which we don't like. But if you have been told you have IBS because you have bloating or gas or constipation or diarrhea, we see that those women have a higher risk of miscarriage. And it's not to scare you, it's to hopefully make you feel more empowered, because even if you don't miscarry, which we hope you do not do ever, complications can happen at the tail end of pregnancy. We can see increased preterm birth. We can also see increased risk of preeclampsia at the end of that pregnancy too. So it's super, super important here. And then IBS also associated with more oxidative stress, that inflammation that affects egg quality. If you've been told you have a high AMH or low AMH, egg quality, if you've been told you have a high AMH, thinking about PCOS, thinking about that follicle development, come back to the gut, think about that oxidative stress here. Plays a really important role in that PCOS, endometriosis, unexplained infertility here.
And something
So
I said on your live earlier was for baby's health, right? Future baby's health at 36, 37 weeks, your vaginal microbiome starts to mirror your gut microbiome so that your baby coming through the birth canal can get that first seeding of gut bacteria. So we want that to be as good as possible. It doesn't have to be perfect, of course, but we want to have nice fighting chance for baby to start off with a good microbiome.
absolutely. And that's a really good point too, right? We are not going to treat all of this and be wanting to see zeros on all of this before her gut is ready enough to conceive again. Even addressing a couple of these things is going to have really massive downstream effects for her hormones and for her fertility story here, because what happens in the gut does not stay in the gut. It echoes through the entire reproductive system, and healing your gut can be a really, really powerful first step towards that odds of a healthy, sustained pregnancy here. And so, it's just, we love the GI map because it gives us so much information and clarifies her story more than if she had enough gut symptoms to go to the gastro or had never done, a gut workup here at all. So even if your digestion seems fine, could be a really important piece in your TTC story. So that is something we always remind people of and want people to be aware of here, because we do uncover bigger gut issues more times than not when we work with clients. And next slide. How do we work with clients? How can you find out if your gut is preventing your conceiving, you're trying to conceive success here, so you can stop guessing and really kind of get to the bottom of it and move forward here. So Fertility Unlocked cohort, this is our signature program here. This is our preferred and most popular way to work with people. And it's also the best bang for your buck. We just added one-on-one visits into the cohort. So now you get the full cohort curriculum. You go through it with a group, which is amazing in terms of the support you receive from women like yourself who are working on conceiving. And so it's a really amazing space to share success stories, to hear about what everyone else is going through. And it creates this amazing kind of place where you can absorb all this other information here that you might not have known you needed in your particular story. And then you get the benefit of working with either myself, Carrie, or Olivia to actually personalize your cohort experience. So we are going to clarify your story for you. We are going to say, this piece of the curriculum is what you really need to focus on. This is the kind of testing we need to see for you. This is what could be going on in your gut. Receiving that personalized interpretation and working up any current labs you have. And then, of course, recommending more if needed here.
And I think another important piece about Clarify that we're really good at is telling you what we still need to clarify, what we still don't know. We will tell you what we still don't know. So, and who out there in the world, whether it's other doctors, other providers, can help us do that and the testing to ask for. So we also set you up for that part of it as well.
Yep. And it's not just about the gut too. Gut, of course, we work up as a root cause stressor, but we are looking at your thyroid, your adrenals as possible other major root cause stressors here. It could be all three. It could be other things. It could be other things that Carrie was thinking about for this particular woman that might be involved in your story, something like an endometriosis or a PCOS. And so this is really a great program if you've been told everything's normal, your labs are all normal, just do IVF, try for a year, then do IVF, and you want deeper answers. You want to actually know what's going on in your story here, so you're actually taking the correct steps to help you get that success you're looking for. This is a great option for that.
And I can't hold my tongue anymore. I'm just blown away by this information. So thank you both for just sharing such a detailed example. And I just want to kind of pull that out big picture and share. I mean, this is why we have to start with Clarify. Okay. You ask us questions on Instagram. I know they're well-meaning, like, hey, is this for me? Can I do this? We don't know. We have no idea. And honestly, by telling you yes or no, or, oh yeah, like, we are holding you back even more, because we aren't actually clarifying your whole story in the context of you as a real person, as a whole person whose fertility is whole life, whole body, whole experience. You can't capture that in a yes or no answer on Instagram, right? So Clarify is the very first step in how we work with anyone in any form. And what makes the cohort so powerful is because we do this together. We're all on this journey together to clarify. not only what you need to focus on, but what you don't need to focus on, which is equally as important, because we know so many of you are trying to do all the things that you've picked up and learned and absorbed. And while that is, alluring, it's how many of you burn out, right? I mean, this is all of our stories. We all have, and just so you know, every single one of us have a very unique story to our own fertility as well. And every single one of us have kind of taken this in and done this whole process ourselves. We've clarified, we've worked through the TAG axis. That's the thyroid, adrenal, gut. We have really walked the walk. And so that's why our cohorts are so powerful. It's starting with that clarify. You then have the power to move on to the next 2 steps of our 3-step process: rebuild and unlock your fertility. All right, rebuild your foundation, unlock your fertility. But you cannot be there. You cannot be at the end. You cannot be thinking, well, I'm doing everything and all the things, and I don't even know what else can help me, if you haven't done the clarify. All right. So that is why we must begin there. And this is just, wow, such a powerful example of a case where gut wasn't even a concern, right? Wasn't even something that they thought was important. And in fact, has now become clarified as the number one thing to work on, as the steps that have to be taken for her body to begin to say, oh, whoa, okay, I'm actually having these stressors taken off my plate, and I can actually change all these downstream hormones and fertility markers to improve my overall fertility picture and success. All right. Anything else on this slide, Kaylee, that I don't want to cut you off here, but anything else here that, I guess we can talk about the enrollment piece here.
Yeah, sure. And so right now we are enrolling for the cohort. So the cohort will begin, we do that official enrollment the July 13th and 14th. But if you submit your deposit now to save your seat in the cohort, because we always do fill up, we cap it at a certain number, about 30 women, because we want to give you that one-on-one personalized care here. If you submit your deposit now, you can actually get a jump on labs. So if you are hearing all of this and you're like, I need a GI map, like I know I just need it, we can get that to you, and you can start collecting that even before cohort starts, so that once we get to the gut piece of curriculum and once you start up with your one-on-one provider, you can have your results back, which is really, really powerful to kind of have some results in hand as you start curriculum. We've gotten that feedback from prior women that have gone through it before. They love to have their labs done and ready as we start the piece. And if you don't want to do that, that's okay too. We'll help you to choose those labs. There's no right or wrong answer here, but it's something that a lot of women have enjoyed having ready to go here. And so, oh yeah, go ahead.
I was going to say, and just winning, if you sign up now, you can win a free Dutch test, which is massive benefit.
Yep. $500, $600, I think, value, depending on that Dutch. So that's really great. And then, of course, also submitting your deposit, it unlocks the lowest price that we offer for cohort. So the price will increase over the next couple of days to weeks here as we get ready. And so that is something that if you submit your deposit now, you're locking in that lowest price for yourself too, which is pretty cool.
And not to rush you, Kaylee, we're not going to go through every one of these. These are just some snapshots of what prior cohort members have had to say. And I mean, you can look at our win section. You can look at our testimonies on YouTube. I mean, you guys do that on your own time, whatever feels good for you. We just love pulling out some of the takeaways that people have, knowing what they want to do to set their body up for success, having a plan, feeling confident that they're not lost in your journey. You're here with a community of a clear and simple ways you can do to improve your fertility, especially after feeling and being told like, well, nothing else to do for you. It's just, and I think, and in here, I mean, I love this bottom one too, right? It is a journey filled with heartbreak, disappointment, stress, right? That's real. This is still going to be a tough journey, but we are here to do it together. And that's a community and the power of that community in the cohort. So powerful. It's just incredible what cohort members have had to say, shifting mindsets, telling that no longer feeling lost, fixing that mindset they were broken and something's wrong with us, confirming ovulation without having pee on a stick. How many of you have PTSD from pee on sticks all month long? So this woman talking about how she's been debating for doing it for a year and just how much she has learned, and so thankful to have been there. So you guys can review these on your own time. If you take a screenshot of these slides and you can be looking at those, but really just to show the power of breaking away from the single mindset of, I'm going to do everything. I'm going to work harder, be better, be more perfect on this journey, because that's what's going to get me my BFP, when actually we need to kind of zoom out, look at the big picture, and clarify what we've been missing. Because yes, those root causes cannot be skipped. They cannot be, I think, what's the word I'm looking for? Undervalued or kind of assumed that they have been touched on, because that's not a standard approach for fertility. It's not in their toolbox to do. So the QR code was there. You can check out our website here, talking more about the cohort, an example of your mobile curriculum that you get. As Kaylee was saying, the cohort VIP, which is the link that she shared here, is the only place to save on your enrollment before July 13th ends. Okay. After that, there's no other option for a discount. We don't play games around this. We're not offering last minute discounts to get people in. The people in here want to be in here. And we aren't out there convincing people who don't see the value in this. You are entered to win that free Dutch test as well, and get started chatting with us. So you can get in there, ask questions, and your VIP access bonus, your access to our chat to talk with us, to ask questions. Get started in your ultimate cohort prep guide, and also get started on testing if that is something that you want to add to the cohorts. We keep this very streamlined in terms of the price. We keep it very low because we don't assume what you need, because no one can tell you what you need before you start clarifying. And so we don't have labs included. So people are like, well, I want labs included. Well, how do we know what you need? And you're going to be paying for something that somebody else might need, but you don't need. So we keep price very low because it is customized from day one till week 8 and beyond. All right. You learn what you need. You only order what you need. You're not paying for standard protocols. You're not paying for standard meal plans. There's nothing cookie cutter here. All right. So, questions, feel free to throw them out here. Kaylee and Carrie, did I miss anything that you all wanted to finish up this amazing presentation with?
No, I think you hit it on. And I think that the most important thing to emphasize is that, say, this woman's yeast level came back like this, and one of your guys' GI maps, say it comes back identical. Your protocol for that yeast treatment could be completely different. There is no one protocol, there's no one supplement, there's no one approach to what is done for treatment here. So it's going to be completely unique and personalized to you and what else is going on, not just one marker on a GI map here. So I think I just want to echo that, because it is so important to be getting proper care, when someone is taking that time to really personalize it for you. And I think it's also really unique and powerful in our particular approach.
And if you want to know more about like other examples of how we clarify, we are diving into that next week. That's all we're discussing next week, is examples of this, not at such a big scale, smaller examples.
Yeah, because as Kaylee just alluded to, you can look the same as somebody else on paper. You can look the same as somebody else in a Facebook fertility support group. You can have low estrogen or low progesterone, and somebody else has that. But the way you go about improving it and correcting it is wildly different.
Mm-hmm.
If we really minimize our understanding of fertility down to a few numbers on a page and comparing them and trying to do what other people are doing and what they've seen success on, is keeping us stuck. All right. So it is the understanding. It's the foundation, is the clarifying. And this is why we freaking love what we do, because it's so powerful. And just every day we are shown again and again the reason why we do it this way. And shown again and again examples of that exact scenario where somebody presents looking very similar, having the same hormone imbalances, having the same struggles, but the reason why is so drastically different. And so there's no box to be put in. There's no protocol to be put in because you fit X, Y, and Z criteria on a checklist. That doesn't exist here. So you can see more of that, of course. We're talking all about this on our Instagram, so check us out there. Everybody's got an Instagram handle. I would encourage you to follow all of us. I'm Your Fertility, Your Future. Kaylee, what's your handle?
Functional fertility research.
And Carrie?
Functional fertility coach.
So give them some love. We just started our accounts because they have been so busy giving this incredible care that you just witnessed to every single person that we work with. Their Instagram accounts are just new, fresh. We're getting those going. So give them some love. Follow them there. There they are. Kaylee put them in the chat. They're sharing tons of great information in there. But you guys are our clients, our sessions, that's where we put our energy. So we hope to see you in the cohort. Take advantage of that discount by getting on that VIP list today. Also, when you roll in the VIP, you get our free fertility repletion method, which we didn't even talk about. You're going to love it. You can go on there and check it out. See for yourself. We'll see you guys soon.
Bye, everybody.
Bye.